one more fabulous app demo left before our break. So Courtney Nicolato is going to present, and come on up with Courtney now. She is going to set up a little bit. She is the Vice President of Healthcare Strategies for Get Real Health. And, you know, there's been a lot of talk about PHRs and how personal data can be put into a PHR. PHRs, on some level, are a kind of way of freezing in amber a patient's past. And really, the power of that data in the kind of traditional, conventional definition of a PHR is retrospective. And it's not the most effective deployment of that data, potentially. And what Get Real Health is cooking up is using that information to really push patients into the future and to engage them in where they're going. So I'm very excited to see what Get Real Health is. And Courtney, take it away.
So hi everybody, I'm Courtney Nicolato. I'm the Vice President of Healthcare Strategies at Get Real Health. We'd like to say we've been in patient engagement before it was cool, right? So it's the buzzword right now. We've heard that it's the blockbuster drug of the century. Get Real Health has built 50 plus different applications all around the world, and we've learned a whole heck of a lot about what patients want, what they need, what they're looking for, and how to leverage those applications to keep them coming, keep them utilizing the platforms. We were also live tweeting throughout the demonstration today, so you see on your screens our Twitter handle, so I'd encourage you to go check it out, and there's a lot more information above and beyond what I'll be demoing today. First, a little bit about our product. We are a patient engagement platform, and so we are built with 200 different health promotion and empowerment tools. Now, these are everything from helping patients graphically understand their information and their data, all the way through to giving them, comprehensive tools and resources to make change. You see some of the things, features that we have, which I'll walk through a demonstration. Everything that we have is available in PC as well as smartphone and tablet. We are very proud of our vast data partnerships. I've just mentioned just a few of them on the screen here. One particularly that you see here is Blue Button. We've been engaged with Blue Button for quite some time. We're very excited that we won the Health 2.0 ONC, one of the placements of the Blue Button Mashup Challenge in November. I'm proud to announce today that we are one of the early adopters with Blue Button Plus. Blue Button Plus will be in our August release of our platform, Instant PHR 3.0, and available to all our clients. For us, the equation when thinking about engaging patients is simple. Taking integrated data, really holistic view of patients' data, because I do not go to my bank and just want to see one aspect of my financial records. I want all of them. Every patient wants a holistic view, so we feel like at Real Health, it's our moral imperative to make sure that that is what we give the patients. But then we marry that with a wealth of data and then tools and resources to help patients really understand, educate, and empower. And we feel this is the secret sauce or the recipe that is going to drive outcomes. I actually have a great example to provide you of some significant results. I'm going to show you today one of our clients, MedStar Health. They're a Washington, D.C. hospital system. They are significantly well-respected. I think many of them are in the group today as well. They deployed our application called eHealth2Go, eHealth2Go.org. And with their diabetes population, underserved population in the Anacostia neighborhood of DC. I gave them a one-touch glucometer. We're connected with Microsoft Health Vault, so over 200 home healthcare devices. And a number of things that the patients really resonated with. The first was the color coding was incredibly powerful for patients to understand where they stood from a healthcare journey perspective. And so, the green versus in the red, they would run to their diabetes educator, say, I'm in the green, I'm in the green. And so utilizing that as a teachable moment to help them understand and empower them to continue to stay in the green. Additionally, we give patients other graphical descriptors. So here you see an example of just their blood glucose data. We also break down information to patients by time of day, because when managing things like diabetes, it's incredibly important to understand when that measurement took place. Also, we have what we call care plans. Now, these aren't your typical kind of clinically driven care plans. These are self-management action plans. These are helping patients really understand, what do I need to do on a routine basis to manage my health? So just to give you an idea, some of these, this is a to-do list. This is also incredibly important, and patients love this on our mobile application as well. So things like checking their blood glucose, they get a yellow half-filled circle when they've partially completed a task, a green check mark. Again, incredibly motivating for the patients to receive those green check marks. And so this helps them then also set a reminder via SMS text, via email. They can share information with their family members. So there's a wealth of different opportunities here for the patients to stay, again, compliant with their treatment protocols. We also capture things called observations or activities for daily living. Now, these are incredibly important because we push all of this data that you see back to the provider, whether it's device data, as well as these observations or activities for daily living. So things like, what's your swelling level on a scale of 1 to 10? How did you sleep last night? What was your pain level? And that information is fed, and then a more collaborative relationship occurs. So here, MedStar is utilizing it for medication adherence. And so they're doing a study and understanding, again, we can aggregate this data and present it. How many days in the last 7 have you taken your insulin? How many days in the last 7 have you taken your other medications? We have groups utilizing this for mental behavioral health, assessing anxiety, concentration, and things like that. What's been incredibly powerful with MedStar is the results that we've seen so far. And so with MedStar and the results, just to give you a quick synopsis, we did a 90-day intervention with their population. We gave them the one-touch glucometer. We saw average hemoglobin A1Cs go from 9.3 to 7.7. We saw average blood glucose go from 181 to 153. We saw a huge uptake in e-health literacy levels. The comprehension and educational levels were significant. And also 88% of the population saw the power of the platform and continued to use it post-intervention. We were concerned about access in that population, and we found out that that was not an issue at all. They found a way. If they didn't have computers in their home, they went to their family member's house, their daughters or their sons. They went to the library. They went to MedStar before their visit. And so there's a lot more that I could show you. Obviously, we had such a short amount of time, but we have other case studies. I would encourage you to go to getrealhealth.com. Check out more information on Instant PHR. We have a great case study section that's interactive that can help you take a look at some of our installations both here in the US and around the world. And encourage you to go to the real stories section. There's an incredible story of Walter, who's utilizing our application to help him in his suicide prevention. So mental and behavioral health are a key component of what we do every day at Instant PHR. So thank you again so much. We appreciate this opportunity.